It can be very scary to witness a child in respiratory distress. It is important that in each school, all trained members should know exactly where the albuterol medication and the nebulizer machine are. These emergency medications should not be locked away, but placed where all can get to them quickly in an emergency. After getting the nebulizer machine and the medication, it is important to check the medication label and make sure that either albuterol or levalbuterol are on the label. Then check the packaging for an expiration date prior to administration. There are two different administration tubing sets. One is the face mask. A face mask is often used for younger children because it is lightweight and face masks are better designed to fit children's smaller features. The other is a mouthpiece, which is the more common delivery method for administering nebulized medication. It is best to begin by cleaning your hands with sanitizer or the traditional hand washing method with soap and water. Next, we begin by connecting the tubing to the bottom of the medication dispenser at one end and to the nebulizer machine on the other. Make sure both ends are twisted securely into place. Once tubing is connected, it is now time to prepare the medication for administration. Albuterol comes in a plastic vial. The top is twisted and removed, and the medication can then be inserted into the top of your dispenser by squeezing the vial. Make sure the vial is emptied completely. Finally, we will securely connect the breathing apparatus to the top of the medication dispenser. Turn the machine on, and you should notice a fine mist escaping from the mouthpiece. Repeat these same steps if using a mask for a younger child, connecting the tubing to the medication dispenser and to the nebulizer machine, and then attaching the face mask securely to the top of the medication dispenser. Again, you should notice a fine vapor mist being released from the face mask. You may notice that the child has labored rapid breathing, coughing, wheezing, and/or retractions with respiratory distress. Retractions are when the child's chest pulls in with each breath, especially around the collarbone and ribs. It is important to provide comfort during this stressful time and to encourage the child to slow their breathing by taking slow, deep breaths in through their nose and blowing out through the mouth. Now it is time to begin the albuterol nebulizer treatment. For the small child, apply the mask to the face by securing it with the attached elastic band. Encourage the child to breathe slowly and deeply to get as much medication into the lungs as possible. Albuterol normally works quickly to open the airways to get oxygen into the lungs. At this point, parents and/or EMS should be en route to pick up the child. Using the mouthpiece with an older child, or if a face mask is unavailable, encourage the child to take slow, deep breaths through their mouth, inhaling as much of the medication as possible. It normally takes approximately 5 to 10 minutes to complete the nebulizer treatment. Toward the end, you may begin to hear a sputtering sound as the medication level decreases. In order for all medication to be administered, tap the side of the dispenser to get all the medication delivered. It is normal for the child to occasionally cough during the treatment as the medication begins to work. Keep in mind that this emergency stop albuterol does not take the place of the child's regularly prescribed rescue asthma medication or inhaler and should only be used when their own medicine has not been provided or is inaccessible in an emergency. Hopefully, this video has helped you to feel confident about giving albuterol in an emergency situation where an asthma attack or other respiratory distress occurs.